You know, one of the things that sometimes we take for granted until you can't see anymore are our eyes. Well, today on the show, we are talking to Dr. Fuller at the Tri-County Eye Clinic here on Dido Road in Gulfport. Dr. Fuller, how are you?
Hi, I'm great.
Well, good.
Thanks for having me.
You're optometrist here at Tri-County. If you would first, give us a little bit of background about yourself.
Well, I'm from Mississippi, and I've been here at Tri-County for about 4 years now. And I live in Pass Christian.
And why optometry? I always like to ask physicians why. Why did you decide to go into that field?
Well, this is actually a second career for me. I worked a little bit in radiology for a little while, and I was always interested in medicine, and I wanted to find a field that I could work in, that I could, you know, have some home time, and not be involved with call and things like that.
Yeah, getting called in the middle of the night.
That's exactly right.
And that's very admirable of you. Well, let's talk a little bit about that. I mean, the importance of, you know, eye health, when you should you know, get your eyes checked, how often. Let's start out though is, you know, what should parents look for? What kind of signs from children should they look for to maybe detect that that child has a problem with their vision?
Well, some of the first signs you can look for is maybe trouble at school, having trouble reading, complaining of headaches at the end of the day. They may notice some squinting, things like that, eye rubbing. Any of those can be signs. And of course, the American Optometric Association really recommends an eye exam even as early as the age of 6 months years old.
Really?
Yes, that's right. So it's important to bring your kids in for a full exam.
Now, I remember when I was little, my problem was, and I wore glasses since I was like 5 years old, is I couldn't see the TV anymore. And my dad used to say, "Why are you sitting so close to the TV?" And I said, "Well, I can't see it." So, you know, that was another thing right there.
That can be a sign also, that's right.
Now, so, you know, but 6 months old, how do you do an eye exam on a 6-month-old?
Well, they don't respond a whole lot, as you can imagine, but we can use a retinoscope, and we can get a good idea of what their prescription may or may not be, just by looking at the reflex that comes from the eye. And then we can use some drops a lot of times. We can dilate the eyes and just really get a good health assessment of the eye is really the most important thing at that point.
Right, and of course, as they grow up, once a year, is that something just like
one
adults?
to 2 years, depending on what we may find or what their prescription may be. That's right.
And of course, as we get older, you know,
and we may see more often. Of course, you know, everybody wants to see clearly, and that's why most people come to the eye doctor. But that's, you know, just one part of the exam. A lot of times, we're really wanting to get a good health assessment of the eye. We want patients to be able to see well years down the road, so we're always looking at signs of glaucoma, diabetes even, or macular degeneration. So it's good to come get the exam just to make sure that you're going to see well years down the road also.
Now, with your vision, are there signs that, as an individual, that maybe that they're seeing that say, you know, maybe something wrong health-wise, like you mentioned, glaucoma, it can be affected by diabetes as well. Are there any kind of special signs that they should look for?
Sometimes people can have, if they have cataracts or something, they may notice a slowly changing with glare, a reduced vision. But a lot of times with glaucoma especially, we're the first ones to see those signs. And it's such a process that a lot of times a patient doesn't know that they've actually lost vision until they see us, and sometimes it's too late. So that's one of the more important things, to get the regular eye exam.
Can you catch it early enough to do something about it?
Yes, we can definitely treat it with drops. Many times we can lower the eye pressure, and that can put a brake and stop some of the progression of the disease.
Now, there's different, I guess, occupations that that people will be in, that they should really probably look at getting an eye exam on a regular basis. Maybe not every 2 years, but maybe once a year, depending on the whatever they're around.
And that's very true. One of the most common issues we have is people having trouble on the computer now. Even I'm carrying my computer around with me. And so many people are spending 8-10 hours a day just staring at that computer monitor. And it may not cause much long-term damage, but it can cause a lot of eye strain, dry eye symptoms, things like that, headaches, that's exactly right. So a lot of times we may be able to give somebody computer glasses and showing them and teaching them on how to reduce some of that end of the day eye strain.
Now, bifocals,
Yes.
with bifocals, it's something that people say, well, I don't like the things with the lines in between them, but bifocals have come so far.
It's changed
in
a lot.
Yeah,
yes,
they don't have those ugly little
that's
lines
right.
in the middle of
that's
them
right.
anymore.
We don't even like to use the B word anymore.
Oh, okay. Sorry.
That's right. So yes, a progressive lens is basically
progressive.
That's right.
That's the new terminology.
That's it. It's a no-line bifocal. So there's a progressive change in power from the distance to the near, and that provides a little bit more of that intermediate range of vision, and it may help improve a little bit of that computer vision, since usually that computer monitor may sit a little further back. And most people like them just because they're a little more cosmetically appealing then too.
Here on the Gulf Coast, we have the sunshine so much, and it's very important to wear protective eyewear whenever you're out.
Yeah, that's right. That's right. We always recommend wearing sunglasses, and that reduces that UV exposure that can be damaging. That can increase your risk of developing
because
cataracts.
people think about UV exposure, they think of the skin. I don't want to get sunburned, don't want to hurt it. But they may not think so much with their eyes.
That's exactly right. So you're going to reduce the progression of cataracts, and you're also going to reduce your risk of developing like macular degeneration by wearing sunglasses.
And of course, the older that we get, we have more issues with our eyes that we should really, pardon the pun, keep an eye on.
That's it. That's it. Well, that's our job, to keep an eye on things. And yes, the older we get, it's important to, wear sunglasses, eat a balanced diet. We always recommend. Of course, everybody always has heard their whole life to eat carrots, and that's certainly important for
vegetables
for eye
as a whole
function.
are great for you.
That's exactly right.
Green vegetables
We
too.
recommend the leafy green vegetables. That's going to provide some of those protective pigments to reduce some of the risk of macular degenerations, and even citrus. Melons, those types of foods can also be very good too.
That's right. So kids, when your mom and dad tell you to eat your peas, this is why. Down the road, technically, it's going to be very important for you. Anything else you want to add? I got about 30 seconds left.
No, I just recommend just getting an annual eye exam and come see us at Tri-County Eye Clinic if we can do anything.
Okay. Of course, you got two locations here on the Gulf Coast, Pops Ferry Road and here on Dino Road in Gulfport.
That's right.
Dr. Fuller, thank you so much.
Thanks so much.
Very important to get an eye exam. As he said, get one on a regular basis. Your kids, you want to think about them as well. If they're having some issues in school, I mean, here it is, a school year now. They have some issues in school. What you need to do is make an appointment. Numbers on your screen. Either location will be convenient for you.